top schools of education in the country. In our school, we produce educators who know how to help children read, write, and problem solve. Our teachers know how to build curriculum and break down instruction that can reach every learner. We put those teachers in front of the classroom, eager and ready to help children be successful in all of their learning. But when we have the child on the side who's hungry, the child in the front who needs glasses but doesn't have them, and the child in the back is experiencing toxic stress from things that are happening outside of the classroom, we've set our teacher up for failure. We have not done our job to help teachers and all school staff think about the link between learning and health. Think about the link means that we understand that learning and health are connected. Learning and health influence each other throughout the entire life course. So health behaviors, like the examples on the previous slide of our failed children in physical health and emotional health, is prerequisite to learning. And we also know that education, or more learning, is related to a longer and higher quality life. So why don't we think about the link in learning and health at the forefront of what we're doing in schools? Well, for one, it's partly historical. It hasn't been the core mission or responsibility of schools who've been charged really with focusing on academic success. For the other, it can be really complex, right? There are so many moving parts and so many things to consider if we're going to think about the link between learning and health. In schools, we have a lot to consider. We have to think about the safety of our environment, how our adult and child relationships are positively focused, what food are we providing, and what are the lessons that we're doing around healthy eating? How do we fit physical movement into our day? And how are we truly engaging with families? That's a lot to consider. And they all move together, right? So if you neglect one, I think of it kind of as like going for a really long jog down the beach wearing fuzzy slippers. Not super effective, because they're all connected. They all influence each other. All of the gears fit together as moving parts. Now, I'm not so naive to think that schools know how to do this or are already doing it really well in connecting learning and health. In fact, in my own role as a school psychologist, I focused on that silo of behavior supports. I sat in behavior support teams building great plans to help students be less disruptive and more engaged. In my research role, I've published lots of studies that demonstrate positive effects of these same types of interventions. But in all of that work, the silo of the behavior lens pretty much stayed the same. I didn't routinely ask questions that could be really important, like, does that child have adequate nutrition? Or is he experiencing toxic stress? And maybe even more importantly, in all those great plans that I was creating, I didn't think about strategies from other gears that might have the same effect on student and behavior, like incorporating things like getting outside, moving, or eating well. So if we agree that we should have schools think about the link in connecting learning and health, how do we help them do that? What do we do to make it be able to work? Because what we've really done in life is set schools up alone. We've thought of them as alone, not connected to the communities in which they work. And when we have that lens, instead of embracing complex change, we're not as effective. So why not change that frame to think of schools as a hub? A hub as a center, a heart, or the core of a network. In embracing complex change that can navigate tracks to get you to the place that you're trying to go. Let's use a really quick example. So let's say that we notice that student anxiety is increased during testing time. That happens, right? So we might say that we have put the physical ed teachers together with the school counselors and the school psychologists to think about an activity that you could embed into phys ed classes, such as mindful breathing. there's an example of how we take two different sets of expertise and pull it together to connect in doing a pretty simple intervention. Now that is a pretty simple intervention, I get that, and it's not really thinking about all the complex pieces. So how do we do that in embracing complex change and collaborative leadership to put all of those gears moving together? One way that we might think about doing that is through what's called implementation science, which basically are the processes that we do when we're trying to get initiatives into place, to do them well, and to make sure that they can sustain over time. Now, there are lots of different models in implementation science, but the general steps or the processes are fairly similar. We could use, for example, the EPIS model to explain what we're trying to talk about here today. In the EPIS model, we start with explore, which basically means that you're assessing your needs and you're trying to decide if something fits, if an initiative or a new activity will fit in your system. Then we move to plan. When we're planning, we've made a decision to do it, but we now have to align our resources and make sure that staff are appropriately trained to do whatever it is we're trying to do. Now we finally move to implement, which means that our leadership is in place and we're pretty confident that we're doing it well. But we aren't done yet, because we have to finish with sustain. And sustain basically means that you're never done, because we need to understand how we're going to continue this over time. So let's go back to our mindful breathing exercise and our activity, where we combined our gears of physical health and behavior supports to address an immediate need. So let's say that was successful. But now, we're looking at what's happening in this setting, and we're seeing that stress and anxiety are a bigger concern beyond just testing periods. And so we might have our leaders get together and think about how do we build a prevention strategy in emotional health around stress and anxiety. We might build an instructional unit that gets delivered in our health education classes so that all students get exposure to this unit as a way to think about prevention for stress and anxiety. But we're still using all of our other gears to think about how do we reinforce the use of those mindful breathing skills. So it might still happen in our phys ed class, our general ed class, or even with the school nurse. And then we're going to bring our families in and engage with them to talk about concerns around stress and anxiety that might be happening outside of the school setting, and think about strategies for building positive emotional health in many different ways. So those are chugging along. We have our instructional unit and we've got our activity and we're moving along in schools. We might then step back and think about how do we extend those same concepts into employee wellness? Are they needed? Why are they needed? And what could we be doing in employee wellness? And then finally, we could pull it all together and engage the community to share the work that we're doing in schools and share our continued concerns, because it's likely that some of our students or teachers or families are going to continue to have stress and anxiety and need supports that are going to be beyond what the school initiatives can provide. So when we think about the link between learning and health, we're understanding the needs of the whole child, the academic, the social, the emotional, and the physical domains. And we're going to work together and we're going to plan and monitor the effects of what we're doing so that we move from hoping to making it happen that schools can successfully be a hub in helping to coordinate all of those efforts. So whether you're a student, a parent, a community member, a teacher, or someone else, I would ask you to consider, how is your system set up to think about the link in supporting the whole child so that schools can successfully be a hub across learning and health, and then we end up putting those great teachers into action in successfully supporting the whole student. Thank you.